Welcome, friends. This is Bringing Better Health to Life, a program sponsored by Conway Medical Center. My guest is Dr. Henry Saunders, and welcome to our show. And I'm anxious to find out exactly what you do for the hospital.
Well, hi, Diane. It's a pleasure to be here. I practice general internal medicine, so I've had privileges at Conway Hospital since 1984 when I moved to Horry County, and I take care of patients both in the office and also in the hospital, and I've been doing it for some time.
I think so, especially since you've been here this is your 27th year.
Right, that's right. Yeah, I was actually recruited by Conway Hospital, it was called then, and I remember they gave me an income guarantee of $60,000, and that was a good raise after I'd been a major in the military. I was in the Army before as an MD and got a raise moving here. I had a partner initially, and then he actually moved back. He actually went back in the military, and I mainly have been in private practice of internal medicine since that time. My office was on Bell Street, near where the old Conway Hospital was, and I took care of patients there and came out here and saw them in the hospital. And I've been doing it for a number of years, and I tell you, it's a pleasure, you know, getting to know the patients and really working with them for a long period of time.
We'll talk more about patient care in a moment, Dr. Saunders, but tell me a little bit more about your background. You said you were in the service, but where was home for you?
Well, I'm originally from Northern Virginia, grew up south of Alexandria, and graduated from high school there. I went to college up at Wesleyan University in Connecticut, and then I actually didn't go to medical school right away. I took 3 years and went to the Peace Corps in Malaysia, and that was a wonderful experience as well.
Well, then that proves you're definitely a people person. You really care.
Well, yes, I did learn things in the Peace Corps about learning about all different kinds of people, interacting with them and caring for them. Yeah, and then after that, I went to medical school in Richmond at the Medical College of Virginia, since I was a Virginia resident. And during school, I got in the Army. I signed up for an Army scholarship. After medical school, they offered me an Army residency where I could be a captain in the Army and do a residency, and they said they would send me out to Hawaii. So I went out to Hawaii for 3 years.
Not bad.
Yes. And I did my internship in internal medicine and my residency there in Tripler Army Medical Center in Hawaii. And then I owed the Army 3 years, so I came back and worked at Kimbrough Army Hospital that's in Fort Meade, Maryland, up between Washington and Baltimore. It was a small hospital. I'm not sure it's even a hospital anymore, but anyway, had a nice experience there, but I was ready to get out of the Army and look for another place to practice. And I enjoy golf and some warm weather, and I said, well, I'm going to come down here toward Myrtle Beach and settle in Horry County, and it's really been a wonderful place to live and have a practice.
Tell me more about your practice. Do you have other doctors in with you?
Most of the time that I've been in practice, I've had my own office. I've been in a solo practice, and I always, it was fine. I work well with others, and I've shared call with other doctors in the hospital for many years. But having my own practice and being able to treat the patient just the way I wanted, both administratively in terms of the way I was running the practice, as well as clinically and what medicines I was doing, that sort of thing, was always, I think, a good experience. Private practice has become increasingly difficult. There's a lot of cumbersome paperwork dealing with insurance companies and pharmacies, and medical care is advancing. We need to have things like electronic medical records or electronic prescribing, and some things that a lot of this is pretty cumbersome and difficult to do as a doctor when you want to practice medicine and not work so hard on the administrative side of things. So just last year, I sold my practice to Conway Physicians Group, which is the physician arm of Conway Medical Center, and just last week, starting in January, I moved to the office on Myrtle Trace Drive that's near the hospital, and so I'm in an office now with several other doctors. And these are doctors that I've known for many years and actually shared call with, Dr. Charles Sasser and Charles Johnson and John Wilson and Camille Mills, and we have a new doctor there, Dr. Habib, and not sure, hope I didn't forget anybody.
But they're all names that we certainly have grown to respect.
Yes, many of them have been in the community for quite some time. And I like I say, I've shared a call with them and know those doctors, and now I'm in the office with them, and it seems to be going fine. The office has been, has very good staff, and my main concern was that my patients would get the kind of personal clinical care that I was delivering as a solo practitioner with CPG, and so far I think that's happening.
I heard that's exactly what they get. We're going to take a break, Dr. Saunders, and when we come back, we're going to dish out some great information for you who are seeing an internist. Are you getting what you deserve? That's the question when we come back on Bringing Better Health to Life.
The Conway Medical Center website provides visitors with a comprehensive resource for their health and wellness inquiries. From our homepage, just click onto Search Health Topics for direct access to the HealthWise knowledge base, where you'll find over 5,000 topics about health conditions, medical tests and procedures, medications, support groups, and everyday health and wellness issues. At Conway Medical Center, we know that better informed patients make better health decisions.
For over 50 years, it's been our mission at Garden City Furniture to offer our customers quality home furnishings at an excellent value and to provide personalized service that is second to none. You'll feel at home at Garden City Furniture on 17 Business in Garden City.
Welcome back to Bringing Better Health to Life. Our guest is Dr. Henry Saunders, and we're talking about what an internist does. For those who don't understand, explain that to us, Dr. Saunders.
Yes, it is, I guess, a confusing term. Some people even confuse it with an internist, an intern, which is the first year after medical school. Internal medicine used to be a specialty, but now it's what we call a primary care specialty, like pediatrics and family practice. It's a practice where the patient can go in and get primary care services, which are, you feel bad or you're sick and you're not sure what specialist to go to, you would go to primary care. Also, we concentrate on disease prevention. Like I spend a lot of my time controlling high blood pressure, controlling diabetes, controlling cholesterol, trying to do smoking counseling, trying to keep people healthy, preventive medicine, cancer screening, all those things are important. But we also take care of people that aren't feeling well, and in the sense that I think too often the way medical care is practiced in this country, people will go to specialists too soon before they need to, and sometimes they get misdirected care, excessive care. In fact, that would be one of my concerns about the way health care is going in this country. And it's been shown in other countries that if there's emphasis on primary care, costs go down and satisfaction goes up. Patients should have a doctor that they can trust and they can talk to. And when you're going to too many doctors, it sometimes doesn't occur. So my practice is involved in primary care of adults. I take care of adults of all ages. Because they have more health concerns, it ends up being a lot of older people. They tend to have to take more medicines and have more problems, so we have to deal with them. But like I say, I think it's important for patients to have a primary care physician. And a lot of what I feel like I need to do is sort of lead people through the complexity of modern medicine. And I think it's better to check with a primary care doctor, have that kind of relationship before you go to any doctor who's advertising on TV, in the newspaper, or you just think someone that you might need to see. I think it saves costs and increases satisfaction. And I think that if you, I think people should have a primary care doctor. And, if you go to him, you should express all your concerns and listen to him and work with him. We can't fix everything. On the other hand, if we can help you with the cost of medicine. We sometimes can prescribe medications less expensive. We can deal with social issues and all those things. And I think that that's what you should expect from an internist. And it's sometimes hard to even deliver that care in our current environment. Everybody's pressured to see patients quickly, and there's a lot of paperwork, and the pharmacies they change their medicines, and it's frustrating for patients and doctors. But that's still where we are, is on the front lines taking care of people.
Dr. Saunders, thank you so very much. We're just about out of time, but I can tell with every breath that you speak, there is no doubt you love what you do. Thank you for being a part of bringing better health to life.
Thank you, Diane.